I mean, like, hi.
Hello,
And
Loretta.
welcome again to the Let's Talk Public Health Show. So today with me, I have Peter Ameh. I hope I got that
Thank God
correct.
you got your pronunciation right, because I was going to crucify you on that. But
Okay, I'm
let's
happy.
go.
I'm happy I got it. I'm happy I got it correctly. So Peter walks in and then is giving us tips and advice on how to spice up our space.
Ma- the vision I have now is top notch. I don't know how I would market it because everything needs to turn into money somehow. And, trust me,
Don't
buy into
worry.
my vision.
Just send your invoice. Send your invoice. We are able, more than able.
Okay, so I will send it to you. I think hits on your boss over there.
Yes, please.
I know he's more than capable. So you guys hear from me. All right.
Yeah,
Hi,
sure.
Loretta. Incredible Loretta.
Incredible, Loretta.
Very. What word would I use? I think words won't fail me now because.
Please, I need to shift this spotlight back on you, please. Today is about you, please. Don't bring me inside. So again, it's lovely to meet you. I mean, amazing work that you do for Concierge MD. Thank you for causing me to be in the box that went to that event with Paystack. It was such a beautiful one for me. I had fun, and I got paid after. Please.
We do that. We cherish our people.
Woo!
Yeah. So we cherish people who work for us and people who work for, and we just want everybody to feel appreciated.
Yeah.
I would take this as an official thanks to you for we called you out, even if it was a bit, well, I won't call it impromptu, but we called you out and then you were magnificent during the show. That's how you know. I'll just keep saying this about Loretta, and you guys can hit her up for magnificent things. So
Thank you.
yeah, but thankful
Thank
for
you.
how the event went, and
Yeah.
it has shaped us into what we want to be.
Woo!
And
And we're going to be talking about that in this podcast. Let us get to it.
can't wait. Let's go.
Okay, so first, I want you to start with your first dream. When you were growing up, what did you want to become?
Okay. So there are different things at different stages.
Hey.
At that time when you just fantasize about a lot of things and play a lot of football, you're thinking, man, I could be a footballer. You could do this, you could score, and I don't want people to come in and be like, this guy is lying here. But those days I could score goals, and all that. So I was thinking, well,
Or maybe you thought you could score goals.
well, I could score goals. I wasn't dreaming about it. I did score goals.
Okay.
So I could do that. But yeah, so when I actually started thinking about career in itself and not just fantasizing about things I enjoy, then it was actually being an accountant. And it was because of the people I had around me. I mean, my brother was an accountant. He had really good friends who come in looking well dressed with the tie that time. I mean, obviously the trousers were really big, so it will look quite weird right now.
They forgive you.
And I know if he hears this, he will laugh at it actually because he still wear big trousers right now.
Wow.
So. Anyways, but I liked the vibe I saw with them. They dressed well. They
had money.
They had money. I mean, they looked like they were having fun with their job. They came in at times in the afternoon. They played around. They went out, tried to do stuff and all that. So I was like, this is exciting. If it's a job and it has this much happiness, I would love to do this.
That.
Right? So that's what I thought I would do. That's what I had in my head. But you go into secondary school and you know how they do it.
If you know math.
Yeah. If you score really high, they're like automatic science class. So we were there in science class. I was thinking, okay, let's do this for one time. But, all these things got really interesting. Biology really was really interesting. You had to do physics and the likes. They were really interesting things, and I excelled in it. So I'm like, okay, this is the way. And my popsy never stopped calling me a doctor.
Interesting.
Right. He was like my doctor all the time. So it was really interesting, and I felt like, okay, I could do this too. And I'd like to explore this field and all that. And,
On the other hand, my parents, I'm sure, well, they're forgiving me, but then they didn't find it funny. Because growing up, I was that child that wanted to be a doctor. I remember stressing my dad to buy me a doctor's kit. So this man travels all the way to the UK and then had to come back like with a box of the steps and the injection and everything. And I'll go around the house trying to practice my skills. And then this girl has been doing well in science class now, scoring the points in biology. And then my final year in secondary school, I started liking my biology teacher. And one day I just asked her in class, I was like, what did you study in uni? She's like, microbiology. And then I was like, nope, I'm studying microbiology.
Really? Wow.
Gosh,
that's a brave move, I'll tell you.
Well, I didn't even know what microbiology was about. Like,
yeah, that's why it's really brave.
My parents did not like it. They were angry. They were boiling because my mom was I think they were already even paying for me to study in the US, like a school for medicine in the US. And I don't know about all this now. I don't know. I did not tell people that's where I want to go. So I mean, it's interesting that you didn't want to study
medicine, but eventually did it. But now, do you regret that? I know I'm gonna push the lights back on you every time, but do you regret that move?
No, I don't. I really I feel like if I had studied medicine, I would have been like many of the doctors in my books, not going anywhere, trying so much to be a surgeon. Because trust me, I'm that person that once I'm in a particular space, I would always want to continue. So,
but you know what? I'm gonna pop in here. And
why now?
I'm sorry.
Why am I being put on the spot?
But because I've heard a lot of people say my child will never study medicine because of how bad medicine has been in Nigeria, right? And it's a bit weird because not everybody has this idea of what you could do with medicine. People just think you do medicine, you go to the clinic, you sit there, and then you must do that. But there's so many things you could do with medicine.
So, like now, I didn't study medicine, but I'm right where I want to be.
Right.
And I'm working with a company that I love working with, and they are into healthcare. And I'm not a doctor, so please.
But it's good. I mean, incredible. But please, guys, allow your children to do medicine, and they could do other things.
Exactly.
In medicine, not just sit in a hospital and then treat malaria and typhoid.
I mean, there's public health, there's healthcare financing, so much.
It's a lot. You could go into research. You could find different things.
Do you understand?
Health economics is still there. You could do a lot for us, right? So, come on.
So to further convince us, right, or convince other people to study medicine, do you want to tell us what you understand by quality care? Yeah. So,
this thing about quality care is interesting. I love your question. Because quality care is different from is differs to different people. So it's very much subjective. I mean, it could go to the line and you could say what I call quality care is different from what you call quality care, even if we have the same condition and we're looking for the same outcome, right? What you call quality care as quote unquote a patient or a client is different from what the doctor will call quality care.
True.
Because it has no knowledge. It's different from what the hospital will call quality care because they're a business.
Oh yeah.
Right? And I'll actually place it on what you call quality care for those two categories. For one, the patient, one, the doctor, and then lastly, the hospital. And then, I'll just round it up because I've been fortunately for me, been in those three positions
at different
times in my life. Of course, if we want to be patients, I've been to, hospitals to try and get care or even doing it online and all that.
Yeah.
And we know what we think quality will be to us. And then people say doctors are the worst patients. I agree to it actually, because you know a lot, you just try to see what your mind is telling you and all that. But anyways, so if I'm a patient or as a patient, I would say quality care is that healthcare I receive at the right time, at the right place, at the right price. Time, place, and price is important to me because I don't want to travel from here to mainland to go and look for care. Come on. I don't want to spend a lot of time looking for it either.
Well, people are choosy, right? What if I love this particular hospital?
That's the thing. I would love that to be next door either. I mean, really. Because I like this hospital does not mean I want to travel for it.
Okay.
I have to travel for it because I have no choice. So I would love that the hospital is close to me. I would love that I won't spend time getting that care and I will get it when I need it. And I love that it's at the right price. I won't go bankrupt. And then lastly, I would love that I return to how I felt before the illness. So I don't want to give a stereotypic definition, but I'll just explain what quality is to different people.
Yeah.
So quality for patients, place, time, the money, and then
Place, time,
the
price.
outcome. Now, note that the outcome here is how I was feeling before.
And how I'm feeling after, like.
So
whatever.
I want to return to how I was feeling before.
But things take time too now.
Yeah, but if I could run with my legs and everything, and I tell you I need quality healthcare, I want to return back to running. That's what I
yeah.
call quality. If you return me back to that stage, it's quality for me.
Then you provided.
You provide quality
great
care. If you do anything less than that, I'll be like, oh well,
You tried,
yeah, but thank you. I raised you good, but really, I'm not really happy. If you tell me, you know what, I could take a step forward and return you back to how you were before, the person will be like, wow, fantastic. You know, so that's it for a patient, right?
Yeah.
And obviously nobody wants to go bankrupt, actually. In any ways. So now for a doctor, and as a doctor.
Or for providers.
So yes, health professionals who provide this care directly, because hospitals provide care indirectly through the doctors.
Yeah.
For providers now, that's the doctors, health professionals, nurses, and the likes.
Nurses are mean. By
They
the way.
are?
So,
You know, my nurses are my people. And because I'm with Concierge MD, I will have nurses. I will not agree to you with that. So
I also,
nurses are
you have
fantastic sort of people.
You have to defend
we love them.
You have to defend this now. Why?
They're lovely and all that. I mean, if you're talking about health professionals, people say a lot of time about health professionals. You speak with doctor and be like, the doctor is not good enough. The doctor is too rude. This one doesn't know what he's saying. Especially if you don't know anything about the field and you seem like, oh, I've read something online already. This is how it should be. I mean, this my older doctor told me that he should do this. He's not doing it. Can you see? He doesn't know what he's saying. And then obviously, I'll get there. You know, but obviously, when you say people are not nice, I feel like a lot of people in the health system they've reached their break point.
Okay.
And it's just a lot to take. For which I would advise, if someone in government or in schools could listen to this, that they please just add all this, emotional intelligence and how to control your emotions and that to the health curriculum.
Oh yeah.
So that no matter how precious it is, which obviously medicine here abroad is a pressured field, right? So, but here is just a lot of pressure with very little tools and compensations for it. So anyway, so if I meet anybody, I've been to the hospital a couple of times, I've spoken with people. If I meet them in different frame of mind, I could recognize it, and I don't just go like it's all your fault for how you're speaking with me. To me, I feel like there are a lot of things that made you do this, and I feel like there's a good person in there because I always look for the positive in everybody, and I just want to relate. And you know what? If that person is being somehow to you rude, if you come and you're pretty nice, oh, very sorry, I understand how you're feeling now, but please, this is what I was thinking. But if you're not in the best place, can I come back?
Yeah.
People just tend to see that, oh, you're really soft and nice, and
then
some of them would just
match
match down. It's just relaxing. Some people can even tell you, oh man, I've been having a really bad day. I'm so sorry how I just reacted, and it's good. So that's that. Now I'll go back to what I was saying. For health professionals, for me, I use myself now because I'm the one talking. So I would say I've delivered quality health service. If I provide health service to someone who have the right information, so I have the right information, I could do all the investigation I need to do.
Interesting.
And I could give the drugs I have as first line. So if I could tell you, if you ask me, have you given quality care to Loretta? I'll say, yeah. I have all the information I need to make the decision I made. I did all the investigation I needed to know to rule out things in my head. Now I'm making really informed decisions, and I have, given the right drugs, which you could get. There's nothing like it's not available or you can afford it. And then obviously, for me, the outcome will be the best possible outcome, not the previous state, as for what patients would think. So best possible outcome will be what I would think. Because if you come in and I feel like, now this is as much as we could salvage and this is where I could get you to, that's the best possible outcome.
So with everything that you've said, right, it almost feels like this space is very complex.
Yes.
Very, very complex.
Yeah.
So what are the factors that determine like this whole quality of care situation? The patients, as you said, sometimes the patients are totally different or thinking in a different manner from the providers. So who is determining this quality of care? What should determine it, if I'm correct?
So now, I would actually give you, I think if I give you a longer definition of quality of care, it's to point out the determining factors. Then I'll go into it. So for me, if you ask me for quality of care, I would say it's the health service that the right patient receives in the right place at the right time.
Yeah.
By the right health professional, right? Who had the right information, did the right investigation, gave the right drugs, leading to the best possible outcome. That's what I'll go with, not previous state, at the right price.
Okay.
Okay, now, looking at that, I think you can pinpoint some things that actually really affect quality of health. I will break it down again. Forgive me, I like breaking things down.
It's fine,
It's
fine,
just the
fine.
best way of passing information,
Yes, please.
you know? All right, so I'll say factors. I will actually, okay, let me just give you like two, let's not go too much. First, I'll say there are patient factors. Secondly, provider factors. And then third, I'll say the government. Government is always involved in quality care. Well, that's what we're fighting. I mean, I'll get there. I mean, this is really interesting. I love discussing this, and you can see how much fire is in me when I'm talking about this. And this is why I'm here with CMD, you know. So, for the patient, socioeconomic factors are really, really important.
So this is number one determinant.
It's number one.
Boom.
I'm telling you, because healthcare is not cheap. When you tell people these are like, you're a heartless doctor, you know, health is not cheap. It just depend on who is paying it. But social fact, I mean, if you go to, I actually pick on demographics and say, now if you go to different classes, I'll say high class, low class. For people in the low class areas, there's some bit of literacy, or not as literate as they need to be, not a lot of funds to seek health. And then in that class, you see people who have traditional values that are really strong. Yeah. So
different wahala.
I'm telling you. So
as they say, wahala be like kukushu.
Oh my God.
Don't mind me.
So you are talking about, one, you don't know that you should seek care. Two, you don't know the symptoms you're having. So you're thinking, nothing. Three, you don't have money. You're like, go to the hospital and pay money. Can't. Four, you are used to taking agbo all the time and then, you know, sleeping things off and then, you know, going to the pharmacy close by and just pop a drug and all that. That's your way of life. That's what you've grown up to know. You go somewhere and put some leaves together and then put things here and all that. So those things contribute to the quality of care you receive at the end of the day, right? People in higher classes can do better. Obviously, they have better exposure. They have better information. They could travel, go seek health anywhere. They could pay for top quality health services. So as a health provider, you could ask for right information from them because you can communicate really well. You could do so as much tests as you need, you know, because it's affordable. I mean, they can afford it. And then you could actually give drugs and they could get it. So it improves your quality of healthcare.
You know, I saw that Nigeria is actually ranked as number 187 out of the 191 countries because of our healthcare. Our healthcare system is ranked this. Now, with this that you've said, I feel like it's more than enough reason to be ranked this low. I mean, so I think what I'm now curious about is we've identified a few determinants.
Yeah.
And as I'm looking at things, it's hard to scale up the ladder. But how would you say that we are going to be able to scale up the ladder? Now, these determinants, can we work with them for our good?
Now, I think it would be really unfair if I say my determinants are just patients, and patients will be like, this is how doctors say this. But I'll just say other determinants could be, one, the doctor competence. I won't actually say too much about it. If the doctor is not competent, can't give you quality care. For the doctor part, I will say compensation. Doctor is not happy, not receiving good funds. Obviously, NRD, they're on strike right now. So you can't get quality care.
Yeah.
And then the government. Policies.
I think that's where the bulk of the work should
Yes,
be,
actually, I agree. Even some government officials will tell you that you guys will be saying this, but in your own side, you're not doing what you're supposed to do. But really, if you're a governing body, the fault for what happens under you falls to you.
Yeah, exactly.
too.
Falls on your your
Yeah,
laps.
it's not, you can't push the blame down to anybody. Your whole responsibility, because you should put policies into place. You should implement them. You should monitor them. You should evaluate them. You should make sure things are working as they should. And you see a lot of things. Now, I would say for government, if we're thinking about, improving our healthcare system, it has to start from the grassroots. We see a lot of times where money goes into tertiary institutions, but come on, if things are being taken care of from the primary end, you will be having so much secondary and tertiary cases.
True.
And then when you now have tertiary centers as the only place where you can get really quality care at affordable prices,
Not everybody can go to.
Nobody can go,
Primary
and
care is literally at every point.
I'm telling you, now these secondary care centers, they are choked up. You want to go to general hospital or teaching hospital today, you have to go there as early as maybe 4 or 5 to write your names down.
Do you know I heard a story that was so heartbreaking? God.
Share. I would love to hear.
When this person was sharing the story with me, honestly, I started crying because I couldn't just imagine how in the world people would have to go through such. So our sister had tuberculosis and she was in the hospital. There were no beds, nowhere to sleep. That was not painful enough. They had to change oxygen. So this thing, so they had to pay for a wheelchair. So she was literally on a wheelchair, and they were giving her treatment on. Imagine someone that is sick, in pain, and then oxygen finished, and they said they had to go and pay for oxygen before they would. Honestly, I started crying. I said, "What? People go through this in this country?" So, I mean, it's a lot of challenges, and I'm curious to know again what CMD wants to do to address the needs of the population. Of course, we know that change would come majorly from the government, or we need the government's approach.
We're actually still in the government of change, so just that your change is probably downwards right now.
And another thing is, the government is just the decision making. So make sure, let's have good policies, let's do things the right way, all of that. But still, how even looking at stats, I don't know, but me personally, and I'm sure a lot of Nigerians would also do same, I am not comfortable going to a federal or a government hospital to receive care. I'm not comfortable.
Why are you not comfortable?
I don't know. I just like when care is brought to my home. When I am in my life, I like to do things in a way that I know that, oh my God, this person cares about what they're doing. For the past 2-3 years now, I've been doing my nails from one single person, one single guy. And he does his nails like his life depends on it. He would be gisting with you, we do filing the nail, and I'm just like, oh my God, yes, this is so perfect. So I'm that kind of person that I enjoy when somebody is providing. If you're providing any service to me and you're doing it shabbily, just get out, because I'm sorry, I don't want. I like when you really care and you can show me that you care about that service that you are offering when you are serving me. And I don't see that being done at general hospital. So I'm not comfortable going there. I don't want a doctor talking to me like I came to beg. I'd not come to beg you, so please.
You're paying for your care, actually. So
Thank you.
Yeah, so what I need to understand now is, even in developed climates where things work, government puts money into this, there is still a mismatch between doctors and patients. And things about home care, concierge care, it's actually a thing out there. It's established, right? So for me, even if our government suddenly try to, change and make some things put in order, it doesn't take out this personal care that you need.
Yeah.
Yeah. So at Concierge MD, what we bring for you is comfort at a good price, right health professional. We care about our patients. We don't want to fall sick. So we are there to giving you the right information. if you register with us, so that you will know what you need.
So even
And
preventive care.
Yeah, preventive care is there. And then obviously we do screening for our clients to make sure, okay, before you won't have something, we're there. Also, we are providing care for you. As I said, the situation I said earlier, right place, right time, at the right price.
Yeah.
Because we want you to have care and not go to somewhere to line up or queue up.
Interesting.
We want you to have care at your home.
I am your target market. if you're like me, please, you're Concierge MD's target market.
And then we are bringing it at an affordable price because we know the situation of things now in Nigeria.
In Nigeria.
Right? And also, people will tell you that, which doctor am I seeing? As you've said, we bring you the right doctors.
Please, I want tall, dark, and handsome doctor.
We bring you the right doctors. Or not the doctor, we bring you the right health professional, be doctor, nurse, nutritionist, dietitian, consultants or people in training or residency and all that. We give you general practitioners. We give you who you need at the time and when you need it, and we get you that service immediately. You ask for it, so you get this doctor at the right time. There's no delay. You don't have to book and come back. You don't have to queue for it. So it's at the comfort of your home. Also, you don't have to worry about who you're seeing. Some people go to the hospital and they tell you, I want to see Dr. A that I saw last week. And Dr. B, it is not reasoning the way Dr. A was reasoning. This one is, we give you these doctors who have been trained, they've been carefully selected, and they will give you equal care. And obviously, you can keep seeing your doctor.
Interesting.
So we give you the right health professional who have been well trained and compensated. They are not frustrated.
Woo!
Really, they are not frustrated. They are not tired of what's happening. I mean, they love their work and they want to work with you. They are eager to work with you. And then the personal touch we give you with our care is you have your doctor for as long as you want.
Interesting.
You could talk to your doctor and tell the doctor about anything, but please, maybe not. Maybe, don't.
I don't understand what you're trying to do there, but okay.
I'm just kidding. So you could talk to your doctor about anything, any single symptom you have. It's your time. We're not counting it for you. You have this doctor in your home or your office space or wherever you want to meet that doctor.
Yeah.
You talk to the doctor at your pace. You get all explanation and counseling that you need, and then even if you need more afterwards, you could get it.
Yeah.
Right? So we give this personal touch, and then we deliver your care, your drug, your investigations to your house. You don't need to go to anywhere.
Honestly, so this is I feel like I need to clap here because this is literally such a perfect way to improve health in a population. Because when people are more comfortable accessing care, they would definitely stop by.
Yeah. I think what everybody wants nowadays is comfort in every area of our lives.
I want comfort.
Comfort is actually really important, and I feel like
I want to be able to give birth in my house. For real.
I mean, if that is the case, I'm sure we'll work something out for you. But let's move. We're expecting you to come here and then tell us what you want. In any case, we have packages that will fit everybody, and we can do bespoke too. We are good like that, right?
Interesting.
And now, taking it a step further, we now add technology into what we're doing.
Ooh,
we have to go techie. If you don't have tech doing your things, it just makes it look too cumbersome and all that.
Yeah.
So we've seen that many times continuity is a problem. Some hospitals are actually adopted it now when they bring in EMR and all that. But still, continuity with the doctor you're seeing, continuity with the care you're having.
Mm-hmm.
So what we do for you is, when you come to us, we have our EMR. There's electronic medical records, where we store your information, and then we have an app at the back end where you can see your information. You don't have to start asking your doctor what happened to you. You don't have to go home and your doctor asks you what happened, and you're like, I
don't
forgot
know. I'm still waiting.
Just need to take our app and then look
they did not tell me.
You can take our app and look at exactly what we've done for you and what is there,
wow,
because we have
that.
it in our app from your end using the Helium dock. Yeah, powered by Helium. Thank you very much. And then with the EMR, your information is well stored, and we have health professionals who will follow up on your information. And everything they said we should do for you, we follow you up with it and make sure that your care does not stop at you coming to the hospital and then coming for another appointment and another appointment. We continue with the care. So we have to continue with our care.
I love that.
And then everything that you need to have, we give it to you, and then we streamline the information we give you to what you have actually, which is incredible.
Incredible job that you are doing at
yes.
CMD. And
thank you very much.
I am so delighted that you joined us on today's podcast. So we'll be wrapping this series up shortly. But before you leave, I want you to just quickly touch on really, what would you want to say to patients? How can care, or how would they feel like they've received better care? You know, should we be more open about our problems? I feel like a lot of people lie about how they really feel.
That's actually really important. You know, now I would say to all patients and myself, right, that if you're actually seeking care, right, she said be open minded, and then try and be as open with your health professional as possible. Say everything. If it's one each somewhere, say it, because you know the thing about symptoms, they interlink. If you say this, we know what this is, and we can link it up into giving you a very good diagnosis.
Interesting.
And you know, I would say be open-minded about your care, because really, some people tell you that they could buy a phone of like 300,000 or 600,000, but they don't actually want to invest in a care plan, and all that. It would love if I try to get everybody in my house into a care plan, so that it's not when it happens you're scrambling. Even at that point, we could still help you at Concierge MD, but be very intentional about your health. Invest in your health. Preventive methods are really important for you. Do your screening, and then when you are actually having any symptom, please do not start and self-medicate. Don't start by self-medicating. See a doctor.
I feel like you're coming for me.
And that's one part of the policy that the government could do for us. Stop all this over-the-counter drugs by having anyhow, and they're limited. But anyways, don't self-medicate. Don't make things worse. Don't let your symptom, drag out. Present your symptom right on time. Immediately you feel it, say it. We are there for you. We're just a call away or a mail away.
Yes.
Give us what you want. Give
so
us a call.
So how can we reach Concierge MD, by the way? What's your phone number, your email, your...
Okay, so yeah, to reach us on Concierge MD, you could send us a mail at hello@conciergemd.care.
Okay.
And then we'll reach back to you right back.
Thank you so much. It's been an awesome time with you on today's podcast. So please, again, I hope you people are deciding to share this one, because you cannot hear all of these germs and then keep it to yourself. Share, let the world know that Concierge MD is here to improve care. Yeah, we're here for you, and I'll catch you on the next episode.
Thank you.
Yes, thank you so much.